All right. Thank you all for being here this evening. Dr. Stacy Hallweger here, joined by Dr. Don VerHulst, who is a medical doctor. This is part 4 of our brain health series. So if you missed parts 1, 2, and 3, you can go to my YouTube channel, which is DRSTACI, Dr. Stacy, and you can find the last 3 recordings on my YouTube if you want to catch up or if you want to share those with other people. But tonight is night 4. And so tonight we're going to be wrapping it up. We're going to kind of do a little recap of the things we've talked about. We're going to dive a little bit into talking. I want to share with you with my personal experience, because I know there's a lot of parents and grandparents out there that want to hear about children and ways that this potentially could help children, as it did with my daughter. And so I want to share that with you all as well tonight. And then we want to be able to give you time to ask questions. Now, we have hundreds of people here and more coming in droves in the waiting room, so we won't be allowing you to unmute, but we will be using the chat. And so if you have a question about the brain, your brain, about anything to do with what we've talked about, or any questions at all to do with neuro, you can put those in the chat, and I'll be sifting and sorting back through it and asking Dr. Don to answer those questions. We'll be doing that together. So like I said, you've heard from Dr. Don, hopefully over the last couple of weeks. He is a wealth of knowledge, information. He is a brand new senior presidential director in our company, which is the top level of the company, he and his wife, Susan. And so they work in partnership together to be able to help people all over the globe improve their quality of life. But his background spans back 40 plus years as a medical doctor, as a person that's been very, very proactive in holistic types of modalities and healing therapies and nutritional types of products. He's been a formulator. He's been an educator, a teacher, a preacher. He has written 5 books. As you can see behind him, you can get those on Amazon and be able to learn all about your health, because he's a huge proponent, as you've heard him say over the last several weeks, of those core principles and foundations for health. So Dr. Don, let's kick this off tonight, of course, by first of all saying we are not here to make any medical claims, right? We are not here to say that any of this technology is intended to treat, cure, diagnose, prevent anything. And obviously, if you're pregnant or nursing or have questions about your health, you're going to go talk to your doctor or your healthcare practitioner. So we're not going to take the replacement of that, but we will share personal experiences and testimonials and experiences that we have had with other people over, gosh, Dr. Don, you've been utilizing this technology, almost 2 years, right?
Yes, 2 years, a little over, well, no, about a year and 3 months now.
Okay.
4 months.
A year and 4 months. Gosh. Okay. Year and 4 months. So you've been using this in your life with your health, with your, obviously your wife and many, many people in your immediate family, and then obviously your larger sphere. So kick us off here and then tell us, like you were just starting to say a minute ago, like, why is this so important that we are concerned about brain health?
Yes, well, as we were talking just a minute ago, I can think of really nothing more important than having brain health, other than maybe keeping your heart beating, because obviously to stay alive, that heart has to beat. But even if your heart is beating, if your brain isn't functioning right, you won't be able to take advantage of that heart beating and live life to its fullest. Of course, the brain controls everything in the body, not only the health of your body and signaling muscles and signaling hormones and neurotransmitters, but also the very process of thinking. I mean, very important thing that we kind of take for granted is during the day, we store memories in the hippocampus in our brain, but then at night, that all important restful time, those memories, when your brain is working right, are uploaded into the cortex, the cerebral cortex, the higher levels of the brain, to put them into long-term memory. And you, of course, you need that, because otherwise you don't take advantage of all the new things that you learn, and you can't remember recent things that have happened. So that's extremely important too. And a good night's sleep is important to brain health, as is exercise. which increases blood flow to your brain and oxygen to your brain, both very necessary. You've heard me say on a couple of these weeks before that although the brain's only about 3 or 4 pounds, so maybe 2 to 3% of your body weight, it actually uses 25% of the oxygen that your body uses. That's how metabolically active your brain is. That's the priority your own body puts on the brain, and that should cause us to take pause and think about it and take note. But you not only need to exercise, get a good night's sleep, deal with stress properly, but you can exercise your brain specifically. And I'm happy to report to you that's exactly what you're doing right now. Anytime you learn new information, anytime you're having your brain active, trying to memorize things and memorizing things, you are literally exercising brain cells. Brain cells are like muscle cells in that sense. Use it and you'll improve it. And every thought that we have specifically builds a pattern in your brain. It's one neuron talking to the next, talking to the next, talking to the next, and that pattern is a thought. And the more we think that thought, the stronger that thought becomes. We call that cabling in brain. That's why in brain neurophysiology, that's why you remember things that you've repeated many times much better than something that maybe you just heard once. And that's a technique to help you to memorize as well. Repetition. Repetition is a really good friend when it comes to brain functioning properly. So we do need to deal with stress. An overly stressed body and brain doesn't function as well. And we need to get enough rest to allow our brains to restore, and then do natural exercise with our muscles that increases blood flow to the brain and keeps nutrients moving to the brain, and then exercising the brain itself with by thinking, the very thinking process. So there's a lot of important things going on, and I'm happy to report to you that you can enhance brain activity by patching. And there's a mechanism in your body that in fact, the restoration mechanism in your body, there's cells that are restoration cells that you're loaded with when you're first born. And in fact, when you're first conceived, a sperm meets an egg, that's your first cell. And every cell from then on for the rest of your life has to have that same genetic material by duplicating itself and then dividing and dividing and dividing. And then some of those cells will become whatever body part you need, skin or muscle or bone. But the body always retains a number of these rejuvenating cells that can become whatever you need them to be. And that's really the definition of a rejuvenating cell, a cell that can become whatever your body needs. Aren't you glad that you have a reserve of cells that can become, in this case, what we're talking about tonight, brain cells or glial cells that literally support brain cells? You have hundreds of millions, no, you have trillions of brain cells. You got about 100 trillion cells in your body, and most of them are brain cells. You've got more brain cells than anything else. And we used to think, in fact, when I got out of medical school, and 40 years ago, I was taught in medical school that you're born with all your brain cells and you don't make any more during your life, and you lose about 10,000 a day, which you do. You lose between 8 and 10,000 a day. And then that doesn't affect you, I was taught, until about age 65 when you start getting pre-senile dementia. Well, that has proven to be totally false. We didn't know it at the time, but now we do. You make brain cells all your life. So even though you're losing 10,000 of them a day, you could make 20,000 in the same day. It depends on a lot of factors, like I was talking about, your getting to bed on time and exercise and fresh air, sunshine even is going to benefit in this arena. But I'm happy to report to you that even though you lose 50% of these rejuvenating cells by the time you're 35, and you lose 90%, up to 90% of them by the time you're 65, you can do something to literally turn back the hands of time, reverse aging, specifically in your brain, and help with long-term memory and focus and learning and attention and all the things that the brain does so well to help us to communicate with one another. Uh, that those things you can enhance with these rejuvenating cells by waking them up, and we do that by signaling a peptide called GHK copper peptide. We talked a lot about that our first 2 weeks. We talked about clinical studies. We showed the clinical studies. We gave very specific information. And these studies, by the way, are independent. They're not done by LifeWave. Not all of them. Some are, but many of them are independent. They are double-blind, placebo-controlled, and even peer-reviewed, many of them. That's the highest level of scrutiny. So we've got some clinical evidence, and we know what happens when we stimulate this signaling molecule, GHK copper peptide, and specifically wake up the rejuvenating cells that can become nerve cells. They can become cells that line the nerves. As nerve cells talk to other nerve cells, it's an electrical impulse that's going on. And we have to have an insulator there, not only for the signal to go fast enough, but so that the signal doesn't cross-link and short circuit. And that actually, when you break down that insulating material called myelin, the myelin sheath, that's what MS is. And many other brain disorders can be associated with the breaking down of that insulating material, the myelin. So the rejuvenating cells can also help your body to make that myelin sheath, that literal insulation around the nerve cell. So there's a lot of things going on in your brain, but the good news is there's a lot you can do to retain brain function, even reverse aging in your brain. And we even talked about the ability for GHK copper peptide to protect the brain from aging and from free radical damage, which causes aging itself, and specifically aging of the brain because it passes the blood-brain barrier, which not everything does, because your brain is very protective of itself and doesn't let just anything get in past this blood-brain barrier, but GHK copper peptide does. So it can do the job for you. And I'm happy to say that I'm wearing my X39 patch every day because I want to support every tissue and organ in my body, but specifically my brain, so that I can seem like I know what I'm doing, Dr. Stacy.
I think you do know what you're doing, Dr. Don.
Thank you.
So, and you're getting sharper and sharper as you age. And Dr. Don, how old are you again? Tell everyone.
I am 67, but I can tell you, I was feeling, a little bit older these past, 5 or 10 years, certainly, certain things I couldn't do. And right now, after patching for a year and 3 months now, I literally feel like I'm 35 and I can do some things that I have not done for decades.
Like get on ladders and play guitars at the top of a ladder?
Yeah, well, let's not go into that.
I was talking to Garrett. Garrett is our USA country manager. Yesterday we were on Zoom, and I said, just congratulations, Dr. Don and Susan VerHulst are brand new senior presidential directors in our organization. He goes, is he the guy with the guitar at convention playing out there all night? I was like, yep, that's Dr. Don. He's like, man, he's a musician. Your brain is sharp as a tack out there on that guitar. And he even said, did you make up a LifeWave song of your own?
I do. I have one. I have what I believe is the LifeWave theme song, and you're all going to hear it pretty soon.
Yes. Can't wait. Well, I'm telling you what, you don't look your age by far. You look new.
Susan says I don't act my age either.
I don't think you act your age either. We spent quite some time together back in May at that beach house at that retreat, and we were listening to you play music till wee hours in the morning, and it was a fun time. So I know you're definitely not acting 67 years old. And that's the power of this technology, right? When your brain is on, right? It is wired and fired and you are going. And I think people want that. They're searching for something to get rid of the brain fog, to get rid of that like monkey muddy mess that they're in, and have that clarity and that focus and that concentration. And you said always learning. sometimes people don't feel like they can learn anything because they don't feel like they can even get through their day with what's going on up inside of their head. And so this technology really helps, like you said, GHK being a huge antioxidant, being, being able to cross that blood-brain barrier and benefit your brain in so many ways is just huge. But I want to shift gears a little bit, and I want to talk because we've got a lot of people that are, of course, asking questions, and this is kind of what I alluded to earlier. Was, you said we're born with an abundance of these regeneration cells, these repairing cells. So then, how is it that kids could have a potential issue to where their brains aren't repairing and regenerating just like this? Like, what is that? So we can kind of segue. I want to segue into that, what happens maybe at birth or after birth, those toxins and even injuries and things like that happen. I want to obviously share a little bit about Taylor's experience and whatnot. How can
Yes.
that happen?
Well, kids are people just like we are people, and they're individuals. And in a given individual, anything can happen. And younger people can have not as many rejuvenating cells active, or they may have the cells, but they're the numbers, but they're not as functioning as well. It can be any number of different things, or there can be trauma. Trauma can be a big part of it. If it's cerebral palsy, just refers to the fact that the brain did not get enough oxygen when the child was very young or being born or just before birth, and that has long-term potential effects on the brain itself. So there's any number of things that could happen, and children are just little people. So the same things that can happen in you can and do happen in your children. And the beautiful thing about this technology, I like to call it smart technology because it is. It goes in and it prioritizes. It works on the most important issue first, and then goes to the next thing and the next thing and the next thing. The problem with that, or challenge, I should say, it's not really a problem, it's just challenge, just to let people educate them about this, is you don't know what's all going on in your body or your child's body. There could be 5 or 10 or 1,000 different things happening right now that are in immediate need of repair and rejuvenation. Your body knows that, and your body will prioritize when you wake up this system by signaling with GHK copper peptide. So that's the good news. That's the new technology. But I'm so thankful it's based on something as simple as photobiomodulation, which is a fancy way of saying light therapy. The same thing exactly that happens when you go in the sunlight. The sun hits your skin, and that wavelength of light causes your body to make vitamin D. That's changing your body with light. It's literally light therapy. That's the same thing that the patches do, only they do it very specifically with a very specific wavelength that, in this case, enhances that signaling molecule, the GHK copper peptide, that has all these wonderful brain benefits. So that's part of the answer for how it may work in a younger person. But once again, on an individual basis, we don't know what will happen. But I'll tell you one thing, the patch will not work unless you wear it. So you got to wear that patch. So let's put those patches on and let's get some results.
I love that. It does not work if you don't put it on. And so here's the thing too. I want to say this because we don't have any clinical studies. We have over 90 clinical studies. We don't have any clinical studies with children. For pregnant women, nursing women, for obvious reasons. We just don't. But I love to say this. You are the adult, right? You make your own choices, your own decisions, and you make your own choices and decisions for your children. You choose what you feed them. You choose what you allow them to watch. You choose every type of activity they are in or not in, everything, right? They're not choosing anything for themselves. And so if you decide for yourself that this is a technology you want to use for your children, that's your own personal choice. For me personally, it was the reason that I found out about this technology was because my good friend April Vaughn called me and said, you have to start using this on Taylor. This will definitely help her improve her quality of life. I said, well, give it to me. I don't care what it is, right? I mean, I've been doing lots of things for a long time. Anything that's going to be safe and healthy and good for her, you feel like it's beneficial, I want it. I want it immediately for her. So keep that in mind when you're deciding if this is for your child. You have to be the adult, you have to be the advocate, you have to be the parent that is going, okay, I want to find things that are safe and natural and using my body's own ability to get itself back into balance in a non-invasive way, right? And so keep that in mind. It's your personal choice. So with that being said, the first person I patched was my child. And I didn't look at any clinical studies. I didn't look at any research. April said this is going to help her. It helped April dramatically in her own health issues in the 1 week she'd used it. And I knew all about the ability of these regenerating cells. I was driving, flying all over the country and out to do different types of injections and therapies and treatments to activate that inside of her body or to put them in, which obviously was invasive. But I know how powerful they are to be able to help the body heal and repair. And when she was 4, she was misdiagnosed with many different types of cancer. We ended up spending a year in the hospital. And during that time, many surgeries happened. She ended up having a brain bleed from one of the surgeries. And so that brain bleed left her, a normal 4-year-old, not able to walk, talk, or take care of herself at all. So a year later, we get out of the hospital on 25 oral and IV meds with a PICC line, a central line, a G tube, a J tube, a trach, and a shunt in her brain. And I am left trying to figure out, do I have a child that's even coherent, cognitive? What is left? Or do I have a vegetable sitting in a wheelchair? So we came home, set up hospital in our master bedroom, and went through the process of going down the holistic path, deep dive, and working to get her off those medications. So a year and a half later, we're off all meds. We got everything out of her body except for the shunt, and we kept a G tube because that's a genius thing to be able to feed proper nutrition, right? When you don't want to eat that through your mouth. And so being able to work with holistic people and practitioners over the years, we did a lot of those things that I just mentioned to be able to help her body activate or reactivate those rejuvenating cells. And so when April shared this with me, I'm like, the price of a cup of coffee a day, it's going to activate her own non-invasive. I stick the patch on her and she goes to school. This is a no-brainer. Like, how fast can I get this? And so I want to share with you that that was my personal choice to use that on my child. Her injuries had taken place 15 years before. Okay, so all the things we did, all the holistic things we did all over this country and out, we did for 15 years. She still had a brain bleed, right? She had had improvements. She, wasn't on medication. She had no health issues whatsoever. She just couldn't walk or talk or take care of herself. She did understand. She was cognitive and she could write with assistance. So we knew she knew. And, maybe she would say, or something like that every once in a while. But when we started using these patches on her, we started very quickly to see changes in her. We started to notice differences even in her voice, in her laugh. I'm like, she sounds different. Her interactions started to change. Her bruising that she had always had just disappeared. Her hormones balanced. She was able to have regular menstrual cycles. Her body physically started to change. And so we started to see these things in the first few weeks, the first few months, 6 months. Wow, we're like, this is crazy, amazing. And at 12 months, it was like, there's a totally different child here. We stayed very consistent. You heard Laura and Dr. Dawn last week talk about some other patches. We stayed very consistent every day using X39. We used Eon and we used Carnosine every day. And so those 3 patches were instrumental in her being able to have a conversation with you, become verbal. Like, we could actually, like, she wasn't talking like I am like this, but you could ask her questions and she would answer on the spot, on command. She had new words. She was interacting with people, right? Laura and her husband Tommy would come over and Taylor would just, laugh and interact and listen to our conversations and be very responsive. She was doing that at school with teachers, with other kids, family members. So it gave her a better quality of life, a better, higher level of joy because she could actually interact with people, right? And so many, many benefits happened over the course of the first year patching. And I'm going to screen share. I want to share with you just a kind of a picture of what that looked like for her for that year. So this is Taylor before we started patching. Happy kid, right? But you can tell there's structural issues. We can tell looking at her eyes. You can look at her teeth. She'd been in a wheelchair for almost 15 years. And even though she had regular weekly chiropractic and massage, and we did acupuncture, and we did all types of, different holistic craniosacral therapy, Feldenkrais, we did all kinds of things with her. We were doing everything, the proper nutrition, detoxification, all the supplements, all the stuff. This was where we were after 15 years of sitting in a wheelchair. This is 6 months after patching. You can see how things have started to loosen up. You can see how things started to shift and change. And then this is at 12 months. So you have a child that physically looks a lot different than this kid sitting over here. And it wasn't that we had her improperly positioned, but her body completely shifted. You can see her eye, it started to open back up again. Things were more center and present. Her teeth actually straightened out. So over time, we saw structural changes in her body as well, too. And I'll share this picture with you. This was a 6-month picture. And this was before, which she doesn't look healthy, but God, she was. This was first thing she woke up in the morning, but look at her eye. You can see this eye, how closed it was. It was from the bone structure shifting, her spine. And over here, and then this is 6 months later. And so we can see changes in that eye, obviously. Things start to improve, and, her hair, I mean, gosh, her hair is so much thicker, long. Look at her hair length. That's a huge amount of hair growth. And so things happen differently for different people. But for those of you that have questions about your kids, you have to be the best advocate for them. You have to make your own personal choice. If it was my child as a young child, a couple years old, 2, 3, 4, 5, would I use this patch? I wish this patch would have been around when Taylor was 4, when all of her issues started to present themselves, and we thought this is what we're supposed to do. The doctor says you have to do this, this, and this. And we thought we were making the best decisions, and we didn't know any different back then, right? And so if I would have had this technology, I would have absolutely been, yes, 100%. Let's do this. Let's help get the body in balance naturally. But that's neither here nor there, right? We're all on our own journey and our own path. Would I have used it on her? Absolutely. I would have. Have I patched kids, little kids? Yeah, I have. Have I watched moms patch their kids and seen huge improvements? I have. I've seen hundreds and even thousands of kids. I remember probably 2 weeks in, one of Laura's brand partners, Amanda, had a son that was nonverbal on all the scales and all the stuff, right? Not, communication, not interactive. And within a very short period of time of patching, he starts interacting with family members, with siblings, and it's a totally different kid. Like he can communicate now where he never could before. And so many kids have been impacted by this over the years that I've seen personally. So you make your own personal choice. But for me, it was the best choice. It was the best choice for my child. And we saw more results from using the patches in 1 year than I had seen from anything. And we did a lot in that 15 years period of time. And we saw benefits from almost all the things that we did. We could see some improvements, but we never saw as dramatic improvements. We never saw as widespread improvements in so many different areas of her life. So I highly recommend, if you're a parent, to take a look at this and make that decision for yourself, but knowing, like Dr. Don said, this is non-invasive. You're not putting anything in your body. You're activating your body's own ability to heal and repair, regenerate itself, and let the body do what it is designed to do. Over time with kids, we see kids bounce back quick. Even obviously, gosh, well, Taylor was a 15-year injury, but we see little ones, we see them bounce back really fast, right? I mean, their bodies are young. They're like, oh yeah, let's go, let's do this. And so we can even see older kids that, same thing, long time they've had XYZ issue, but they start to see progress. And so that's exciting for you as a parent, a grandparent. It's exciting for the child because they have a new level of interaction and communication and in participation in their environment. So, Dr. Don, what do you think about that before we go to our Q&A part of it?
Yes, I think it's fascinating. And like you said, everybody's an individual, but let me take you just for a second to the other end of the spectrum, where I've seen one of the most dramatic examples of success with patching, and that's my own mother, who's 88 years old,
Mm.
and she's on no pharmaceuticals, and she's been on great nutrition. She's an exerciser, and she's done all the right things that we know to do for many, many years. But I did notice in the last several years, her short term memory was not working properly. Certainly, she would say something and then just a minute later say it again several times. And she coped with it by writing things down, but it was very noticeable. She started patching when I did about a year and 3 months ago. And I'd say about 3 to 6 months in, there was a significant change that started to happen, but it took several months. It took maybe 6 months, so about 9 months in to a year, and she's a different person.
Mhm.
She no longer has short-term memory deficit. This is a direct brain benefit on memory and specifically storing short-term memory to long-term and remembering things that happen immediately, which is the first thing to go as you get older and as you age. Most people will experience the short-term memory deficit. They can remember something that happened 50 or 70 years ago, but they might not be able to remember something that they just learned 5 minutes or 30 seconds ago. Very, very common. And there's nothing we can do about that in allopathic medicine, which is what I'm trained in as an MD, even in naturopathic or chiropractic. I mean, they all have their things that they attempt to support. But this, for me, is some of the most powerful research. Just like you with your daughter, you're with her every day. And
Mhm.
I'm with my mother quite a bit, and it has been significant. I've noticed the difference, and it would be worth it if that's the only thing that a patch ever did for anyone in our family. But of course, it's done much more for many of us, and even me personally. I'd say the greatest benefit I've gotten from patching, although I've got tremendous energy, I feel much younger. I'm not getting up in the bathroom to go to the bathroom 3 to 4 times a night. That happened very quickly within about 5 weeks or so. But I'd say for me, it's balancing neurotransmitters. I had struggled with depression, and I have absolutely no temptation whatsoever in that regard. I have great energy, but it's balanced energy. It's not like a caffeine or amphetamine thing or a
Mhm.
hyped up thing, which I struggled with to a limited degree. Just a balanced, focused ability to think, much like when I was in my 30s, and that's a huge benefit to me. So directly seeing those kinds of things. I mean, I've read the research and I've seen the studies, and I think it's all wonderful, and valid science is powerful, and I recommend that you look into it and study that for yourself. But boy, there's nothing like having firsthand testimonies like I have in my own body, and Susan, my wife, and then my own mother, 88 years old, literally reverse aging her brain. So pretty powerful stuff, Dr. Stacy.
Very powerful. So we always say from 2 to 102. Anywhere in between, right?
Right?
Okay, so let's do some Q&A. You want to do some Q&A?
Yeah, let's do it.
Okay, so someone is saying, now remember, if you're going to list a disease or a syndrome, something like that, we're not going to directly address that because we're not doing that with the patches. But someone is saying that their son is on the spectrum, okay, which we're not going to address that, but they want to know how to use the patches to support the symptoms to improve concentration.
Yes. Well, concentration, of course, is a primary brain function. So what we want to do primarily is get the GHK copper peptide signaling molecule active. And
Mhm.
we do that with X39. So X39 is going to go to the top of the list. Now, I always recommend using with X39 Eon, which is the anti-inflammatory patch, because when you wake up stem cells, and I promise you, you will wake up your rejuvenating cells when you use this mechanism, they are attracted to activity, and activity is where the inflammation is. And so many of these rejuvenating cells will be consumed by the activity of inflammation, and then you won't get as quick a result as if you keep the inflammation down. Now you're going to get a quicker and better result using the X39 patch. So those are the two that I'm going to say are going to be foundational for concentration, for brain function, supporting every organ system, but particularly here, what we're concentrating on is the brain. And we have a number of testimonies showing how beneficial this is when children can have some of these disorders in dealing with other people, how you function in interaction with other people, which is controlled by the brain, proper brain function. So there is something we can do about that. And those are the two patches I would start with, Dr. Stacy.
Perfect. I love that. All right. So someone said this is not specifically brain, but neuro. They have someone with a central spinal cord injury, C3, legally a quad, but can walk and control bowel and bladder. Just no signal to the brain for spatial awareness or feeling below the mid chest. Lots of gabapentin to control the nerve pain. What would you say these patches, what patches could benefit someone in that situation if possible?
Well, I don't know of anything in allopathic medicine where I was trained as an MD, or particularly in naturopathic medicine, or chiropractic or osteopathic, which I've received formal training in all of those areas. I don't know of anything that's going to give you much hope in that situation, because that is a very difficult and extenuating circumstance. However, when you get these rejuvenating cells to function at a healthier, more youthful state, which you can do by getting that signaling molecule going, the GHK copper peptide, and then keeping inflammation down, you can have a tremendous benefit even in a spinal injury like this. And in fact, it's the only thing that I know of that can address the cause of the problem. We say, how's it do that? Literally helping nerves in the spine to grow. We can rejuvenate those nerves when we increase that signaling molecule, that GHK copper peptide. So you got to get your X39 on C7, the bump at the base of your neck. That's where the clinicals were done using it. So we use it there, although it would work anywhere on the body. And then your EON to keep that inflammation down so we get quicker and better results. I start everyone with those two patches. And let me say this, you can get all the results of any patch and every patch even used together by just using the X39. You say, well, then why wouldn't you just use that one? Because it's going to take longer. So, but it literally can do everything all the other patches can do. But in many cases, we don't want to wait. Certainly, if you've got something going on that you're trying to target, you want to keep inflammation down so you can get a better result no matter what that is. The beautiful thing about this, you don't even have to figure out what's going on in the body specifically, because it's smart technology. It will prioritize for you, but you do have to get the X39 on, get the EON on. Everybody needs to be on both of those patches. And by the way, the question always comes up, well, you said you're supposed to wear those for 1 month for every decade of life. So I'm 67 years old. So I'm lived 6 of those decades. I'm in my 7th. So after 7 months, did I quit using the patches? No, I wouldn't. If I wouldn't have lost the gains that I had gotten, but I've gone back to aging the way I did, which I don't want to do. So you can bet I'm going to have this X39 and EON on from now on, because I do not want to go back where I was. In fact, I want to continue to get and stay young.
Yes, absolutely. I hear you. Me too. Okay, so what do you recommend for eyes? Obviously, your eyes are in your brain. We obviously, like you said, X39, EON. Is there another patch that you would say would benefit the eyesight?
I know that the carnosine could be helpful in that regard. And I always say with carnosine, there's 2 criterion for whether or not you should use it. If you have a heart or a brain or nerve cells, you need to use the carnosine, and that's primarily what it targets toward. But literally, the outgrowth of the brain is what we use to the optic nerves. They're just an extension of your brain out into your eyes. So specifically, I would add carnosine to that.
Perfect. I totally agree. And someone was asking about macular degeneration. Same thing. Was that what you would also? Okay.
And there's not much you can do for that. That's a very difficult situation. Not much hope there. There are different things you can do to try to slow down the progression without much success there either, I might say. But this attacks the cause of the problem. So let your body go to work by getting on your X39, getting on your Eon.
Absolutely. All right. So we've got a couple of questions here, real quick, that are not brain related. Chronic constipation, X39 Eon, SP6. What would you say?
Yeah, I would say exactly those three. Of course, the first two for reasons that we've spoken already. And by the way, the GI tract turns over very quickly. You get new cells lining your stomach every 3 to 5 days because of the high acid content there. And literally, the GI tract is turning over every second. So that makes the X39 rejuvenating cell patch even more quickly effective. So those are very important. And there's always a lot of inflammation in the GI tract because that's where your body decides what's going to get in and become part of you or stay in the GI tract, which is really outside your body from your mouth, your esophagus, stomach, small intestine, large intestine, and exiting out the body. That food tube is literally outside your body. And the big decision your GI tract makes for you is, should I let stuff in and become part of me, or keep it there as waste and move it efficiently and effectively out of my body? So those are very important, the X39 and Eon, of course. And if you listen to me answer questions for any period of time, you'll say, you say the same thing for everybody. And I do. I always start with the dynamic duo, the
Always.
X39 and Eon. However, the next patch that I would encourage is the one that you would also, Dr. Stacy, and that's the SP6, which is specifically for organ support. And specific organs that it specializes in is good for every organ system, the heart, the lungs, the skin, which is the largest organ in your body, but the glands. It's very specifically supported for glands. For example, the thyroid gland, which determines metabolism, the rate at which you burn calories, the adrenal glands, which secrete adrenaline and help you deal with stress. And if you got too much stress, you're putting that cortisol out, and that causes accumulation of what I call toxic belly fat, which is a indicator of all kinds of potential problems, especially in the cardiovascular system. And then the pancreas is a very important gland that not only makes digestive enzymes so you can break down your food and get the nutrients that are essential for life, for getting and staying healthy, but even more importantly, is to help balance blood sugar. When your blood sugar is high, excess blood sugar is converted into fat in your body, and every extra pound of fat, you have over 100 miles of blood vessels that are necessary to keep that fat alive. But even more importantly, when you have high blood sugar, anytime high sugar content gets around protein, which your body is literally made of protein, you're mostly protein, mostly collagen, you're going to get AGES form, AGES, advanced glycation end products. This is the thing that makes your body brittle, dried out, and it's why diabetics have such a problem with every system, especially the cardiovascular system, the nerves, those kinds of issues. Some physicians even call it endocrinologist diabetes, type 3 diabetes, Alzheimer's, they call that, because it's literally your brain getting brittle and drying up. So you definitely want to avoid that. So you want support in that pancreas and the ovaries, the testes, the pituitary gland, which has so many things, that the pineal gland, the master gland that controls other glands, including making melatonin so you can sleep better, which, by the way, the most common thing I hear from people when they start using the X39 is, other than just general sense of well-being, would be sleeping better. And sleeping is so foundational to your health. And then probably sustained energy, I hear next. And most people, 3 to 6 weeks, they're going to notice something. What I can't predict is how quickly it'll happen. We love it when someone's a one patch wonder. It happens the very first day or a couple days or in a week. Most of the time, it's going to be 3 to 6 weeks. Rarely, it's several months, but eventually you will notice the difference. Don't be discouraged. In fact, if you're not sensing anything, it means your body's working on things you're not even aware of, and you need that work done. Trust me, you don't even want to know some of the things that are going on in your body, and you will never know them because your body's functioning the way it wants to, and you're enhancing that process. That's what I love about this natural photobiomodulation, literal wearable light therapy. It's like putting the sun on your body and letting it specifically do what it wants to do.
I love that. Great explanation. All right. So, another question that's not brain, real quickly. What about high blood pressure? You talked about the heart when we started here, how important it is. What would you say for someone that they have issues? And obviously, we know pain causes that, stress causes that, food causes that. So, let's look
Well,
at those things. But
first of all, let me. I guess you're going to get me get my passion going here. They say if you're really motivated about something, it's a clue that you're called to help solve that issue. But if something makes you mad, it's also a clue that you're called to be part of the solution. And I'm telling you, hypertension, high blood pressure is one of those things that makes me mad, not because of the high blood pressure making me mad, but because high blood pressure is thought of as a disease. It is not. It is a symptom. It's a red flag. It's your body saying, hey, something's wrong here. I don't have normal blood pressure. It's high. Why is it high? Well, there's a number of reasons. Most commonly, it's because the arteries are hardening, atherosclerosis. Well, why is that happening? Most commonly, it's because there's arterial damage, free radical damage that you need to protect against. You need to restore the endothelium, the lining of those blood vessels. So you'll get me really going here. I'm very passionate about high blood pressure. Is not just another subject to me. It's something that is totally not misdiagnosed, mistreated. I mean, not very complicated word, is it there? It's mistreated because we come in and we artificially lower the blood pressure. That's not the problem. The problem is the condition of the blood vessels, the intima, the lining is not soft and supple. The muscles aren't working right in the blood vessel because you have muscles in your arteries. You don't have them in veins. That's a passive system. So we ignore the cause. And then when we artificially lower the blood pressure with pharmaceuticals, poisons with a desirable side effect, which is, we can take your blood pressure all the way down to zero. I don't try this at home. But sometimes it goes too low, orthostatic hypotension, people start fainting, they get up and they get dizzy. And there's definitely issues with the antihypertensive medications, including tanking out your potassium, depleting your body of potassium. You need to be eating a banana a day if you're taking those kinds of medications. But so it's a red flag. It's telling you something's wrong. What's wrong? Well, I don't know what's wrong, but your body knows what's wrong. And I know by restoring the blood vessel itself, certainly the lining of that blood vessel, that's going to help. And it's the same way with cholesterol. I know that's not part of the question, but with the cholesterol lowering medications are some of the ones I hate the most. And I'm not saying that there's never a time to use cholesterol lowering medications or blood pressure lowering medications. If you have malignant hypertension and tremendously high, it is beneficial to keep it down, but you should also work on correcting what causes the problem. The cholesterol is just totally mistreated. The body uses cholesterol as a band-aid. It's because of damage to the inside lining of the blood vessels. The body makes cholesterol to go patch it up and try to keep it from being damaged anymore. We come in and see all that high cholesterol, which is once again just telling us something's wrong in the arterial system. But the problem is not the cholesterol itself. You artificially lower the cholesterol in the natural area, in the allopathic traditional medical approach. You're ignoring the cause. You're making the cause worse because you're ignoring it. And there's a lot of side effects from those medications, both with the brain itself and with the liver and kidneys. So, boy, you don't get me started on these things. There's a better way to approach these. And, you just have to ask yourself, if you're taking something in your body every day, here's a good criterion. Say, is my body deficient in this? And I'll tell you something, your body is not deficient in a cholesterol lowering pharmaceutical. It's not deficient in a blood pressure lowering pharmaceutical. Now, it may be deficient in antioxidants that are designed to protect the intima, the lining of that blood vessel, the ACEs, the vitamin A, C, E, the trace mineral selenium. Your liver might not be making the glutathione that it should, which rejuvenates all of those ACEs, like we talked about last week. So don't get me started on this, Dr. Stacy. I guess I already did. I probably overspoke my.
I love it. I do. And I'm sure that everyone else is loving this as well too, because it's important. We need to hear these things and know these things. And right? You understand the intricacies of the heart, of the body, of every area.
And don't take my word for it. In fact, I'd recommend, I'll put a plug out here for them. Dr. Sinatra, Steven Sinatra. You can Google Steven Sinatra. He's a board certified cardiologist, written books on this subject that I'm telling you about. He's the guy you want to listen to. He's the guy you want to make sure your cardiologist is in line with. And very few cardiologists are, because they don't know. And they, like you and I, don't know what they don't know.
Yeah. And they just know writing those prescriptions.
They do know that, because that's what you're taught to do. And follow the money trail on that. It is not because it works. It's because it makes a lot of money for certain people.
Exactly. All right. So we're going to go back to the brain again. We've got a couple questions. One is, what if the words or letters are flipped back and forth in your words? What would be beneficial for that? And then what would happen if you have someone that has an attention issue? What would you recommend for those two, Dr. Don?
Well, we talked about oh my gosh, what is the C word that we talked about in the first, where the brain, the balancing the hemispheres, you know what it is?
Coherence.
Coherence. Yeah, I need a little coherence here, don't I? Balance between the brains. And sometimes that can cause the flipping thing that you've described, or a concentration issue, how quickly you can go from one hemisphere to the other can be involved in both of these processes. So you just need really good brain cell health, good neuron health. And so I'm going to go with X39, Eon, and Carnacy.
I love that. Love, love, love that. Thank you. All right. So this technology is reactivating our regenerating cells. Is there a chance we'll eventually run out of cells, and will it help us make more?
Well, there's a 100% likelihood that you're going to run out of cells. It's called death. And it's happening to all of us at some point. But we do want to delay that. And we want to live long and strong. And your health is your choice. And there's a lot of things you can do to make the journey on the way to the running out of cells the best that it can be. Yeah, you're going to run out of them at some point. But you don't have to get sick and die. That's my own personal belief. And I've seen many people do it both ways. They get sick and die, or they don't. So when your number of your days are fulfilled, you can simply pass out of this body and move on to the next world. You don't have to get sick to do it.
Exactly. All right. So people are asking where to put the patch. And I know you had mentioned the CV7, that bumpy vertebrae back there on the back of the neck. That's where our clinical studies were done. And so they're asking, well, if I have brain neuro issues, do I have to patch in a certain spot? Does it really matter?
It does not really matter. And I'll tell you why I think it's important to do the C7, where the base, if you just put your hand down the back of your neck, down the back of your head, at the base of your skull, down at the bottom of your neck, there's a little bigger bump. That's C7. But if you miss it by an inch up, down, left, right, it doesn't matter. Just get in that general area. Now, there are some scientific reasons to use that area to increase GHK copper peptide, for example, which is what this patch is targeting. And because it is an energy meridian, it is an acupuncture point, and the clinicals were done in that position. But that very patch will work on the back of your hand, or the back of your thigh, or at the bottom of your big toe. It works the same way, and it will work the same way. But I think for simplicity's sake, and because that's where the clinical studies were done, wear that patch, the X39, right there on C7. Now, the Eon, I'll say a little bit different here. I always personally wear my Eon an inch below my belly button, because that's another place an energy meridian in a specific spot, and there's some science for that. But if you are having some pain in the area or difficulty in an area, you can take that Eon patch and put it right on there. And I'll just tell you quickly an example is a good friend of mine who's a pastor, been friends for 40 years, and he started patching. He got some great results. In fact, he had to lower his thyroid medication. He had his thyroid irradiated from cancer 10 years ago, and had to be on thyroid medication, had to cut the medication down because his thyroid woke back up and started working, very excited. But he had an elbow problem, and he couldn't even lift a cup of coffee without pain, and had been wearing the Eon an inch below his belly button. So Susan had the idea, said, take that Eon and put it right on your elbow. And immediately, within days, the pain was gone. It's remained gone. And I don't think he has to even wear that patch there anymore, but that made a difference. So for some reason, the anti-inflammatory Eon patch, I will endorse trying in different spots. But I think it's really important, especially for new people learning this, that we don't get too complicated about patch placement. Put the X39 in the back of your neck, put the Eon an inch below your belly button or where you may be having a specific issue. The other patches, there are a couple that have some specific points that you put them on. The SP6 is one of them, on that left leg, on the inside of your knee, or the inside just above your ankle. Those are chosen points. Well, it's spleen point 6, SP6, that's what it stands for. So there are some specific individual patches, but any patch can be worn on the back of your neck and an inch below your belly button. And you can wear multiple patches. Like I wear my X49 right below my Eon, or right above my Eon, or sometimes right below my X39 or right above it. So you can place them anywhere, but I'd say for convention and simplicity, certainly with a new person, just start with that X39 on the back of your neck, the Eon and anti-inflammatory patch an inch below your belly button, and then we'll go from there.
Perfect. Thank you. Okay, so now you got them on a roll. We have 1 minute, but you got them on a roll with this heart talk, which is fantastic. So can you tell me the name of the cardiologist one more time?
Yeah, Dr. Steven Sinatra, MD.
Okay,
I think it's spelled the same way as Frank Sinatra.
Frank Sinatra.
No relation there. Steven Sinatra, MD. He's written books on the subject. If you Google him, you can find out all about this. And he's a mentor of mine. I met him personally.
Okay, thank you. And then they're also saying, you talked about the blood pressure, cholesterol issues. What patches would you recommend would be options for people in those situations?
Well,
Obviously, we know, I was just going to say 39 and 49 we can see in clinical studies in 60 days reduction, but what would you say, Dr. John?
Yes, and but what we want to do is heal and restore and support the lining of the blood vessel. And that's going to happen best with X39 and keeping the inflammation down with the Eon. So that's the starting point. Probably next most important, even before the carnosine, I'm going to go, well, I don't know, equal carnosine and glutathione toss up. And you could wear a glutathione one day and a carnosine the next, glutathione the one day, alternate those two. That's what I'm going to go with, Dr. Stacy, unless you have a better idea.
I love it. I love that.
And X49 and X39 together are a tremendous pair. It's a whole nother subject, but you literally protect yourself from the negative electromagnetic forces that are out there, including the one that we've chosen, the 60 cycles per second for our electricity in our homes, which is a negative effect on our health, and our phones that we're putting by our brains all the time, that they specifically help when you're using X39, X49 together, but X49 for strong bones and for performance, building muscle, burning fat, stamina. I love that patch.
Yeah. And people, you guys need to understand too, you, just like Dr. Don said before, you can just use X39. You will eventually cross all the things off your list. It may not happen in 4 months or 6 months or 12 months. It may be 2 years or 3 years, but you'll eventually get there. Your body's repair and regeneration cells will all wake up and repair your body. That's a given, right? We've seen that happen countless, we're 4.5 years into using this patch now. But when you look at these other supportive patches, they can support the organs and systems. Can you wear multiple? Yes. Just like Dr. Don said, I'm the same way. X39 Eon for everything. Can I use X39 Eon and carnosine at the same time, same day? Yes, you can. Can I put some on at night, some on at day? You can mix and match. Just remember 3949 energy enhancer, day only, right? You can't mix those, but you can use your carnosine or your glutathione or your Eon at night if you want to. You can use your SP6 at night if you want to. It's your personal choice. Play around with it. Everybody's body's going to be different. And, like you said, you can do carnosine, one day, glutathione the next, or, just remember that you have to use your own intelligence inside of your body. Tap into your body's own ability to go, this feels good to me. Or, oh my gosh, I'm detoxing a little too fast. Let me drink more water. Let me get hydrated. Let me actually, focus on some electrolytes, some good healthy minerals that come into my body, and use your own judgment, right? You're your best advocate. You should be. And so you may be learning your body through this process, okay? Learning how you feel and feeling new sensations and new experiences, things you didn't even remember, right? Things are waking up. So just be patient with the process. No matter what patch you're using or what patch combination you're using, be patient with the process. Know the process will take time. It will take time for your body to repair and regenerate itself, but you will get there. And, get back with a person that invited you. You can have that private conversation with them. Hey, what do you think? What do you recommend? We're all connected here in a network of people that work together to help each other, to support each other, to make sure that you're feeling confident and comfortable with what you're doing. We're not all doctors and nurses, and we're not your doctors, right? And so we're not saying we're going to tell you exactly what to do, and this is what you're going to do, but we can help you and guide you in that process. No matter if you're a doctor or practitioner or not, you don't have to be to care about somebody and say, we have testimonials, right? We have those recorded testimonials that we can share with people. So Dr. Don, I'm so grateful for you being here the last 4 weeks, taking your time out to really pour into everyone just your vast amount of knowledge in your brain about the brain. And I know that so many people have gained so much value. I can see obviously from the recordings on my YouTube channel, the views are tens of thousands of people that have watched your Zooms in the last, month, 6 weeks that we've been doing these Zooms. And I really appreciate you taking the time to help people.
Thank you, Dr. Stacy. And likewise, we appreciate you lending your time and your acumen and your information and just compassion for people and their health and all that you do. But I'll tell you, the best thing you can do for your brain is get a batch and start to patch.
Get a batch and start to patch. Oh my God, I love it. Get a batch and start to patch. All right. Well, thank you, Dr. Don. Thank you all for being here. We look forward to seeing you all next Tuesday.